Hi guys, welcome to this week's video. This is part one of a two-part story. I went ahead and I split it into two parts because it was getting kind of long and I thought it would be better in two smaller pieces. Also, my AI friend Sally is going to be doing the narrating for me. These videos explain what ceramides are and how they can help in predicting the health of your heart. As always, feel free to leave me comments if you've heard anything of ceramides. If you get something out of this video and you like it, hit that like bell. And feel free to subscribe. Doesn't cost you anything and it helps the channel. And thanks guys. So now let's get started.
At age 65, Stephanie Blinderman had a valid reason to be concerned about heart disease. Her father required surgery to have blocked arteries bypassed, and 3 of her sisters passed away from heart attacks in their 40s or early 50s. She also had an inflammatory ailment, which causes ongoing inflammation and raises the risk of cardiovascular disease. I have an intriguing medical chart, declares Blinderman, a Prior Lake, Minnesota, real estate agent. Nonetheless, Blinderman's usual lab findings weren't concerning. Her low-density lipoprotein, LDL, or bad cholesterol, stayed around the usual range of 100 mg per deciliter during checks. And both her good and bad cholesterol levels stayed within the acceptable range. She explains, "I thought I was riding along just fine." However, Blinderman's risk was ambiguous, so in late 2021, her physician made the decision to refer her to Mayo Clinic cardiologist Vlad Vasila. Vlad suggested a test for lipids called ceramides, molecules Blinderman had never heard of, to determine Blinderman's propensity for atherosclerosis. Long ignored, they are now being recognized as potent substitutes for LDL cholesterol and other traditional risk factors for heart disease. Blinderman's score was relatively high, indicating that she had a more than twice as high risk of experiencing a cardiovascular event such as a heart attack as someone with a low score. "That woke us up a lot," she said. "The broader tale was given to me by the ceramides." She changed her diet and exercise routine in addition to starting to take cholesterol-lowering medication. The medicinal applications of ceramides are also gaining traction with physicians and pharmaceutical businesses. Blinderman is just one of a small number of Americans who have had ceramide blood testing, which is exclusively done at the Mayo Clinic. And Quest Diagnostics, later this year, will begin offering the analysis, possibly letting more patients have availability. At least 2 businesses anticipate starting clinical trials for the first medications particularly created to decrease ceramide levels in the coming year or so. In addition, scientists are improving their understanding of how these molecules, which make up less than 1% of the body's lipids, have such a strong impact on our physiology. A number of biological processes depend on ceramides. Yet, a number of studies also link these molecules to conditions including diabetes, fatty liver disease, and heart disease, raising the possibility that they potentially have negative effects. According to physiologist Philip Shearer of the University of Texas Southwestern Medical Center, there is overwhelming evidence that ceramides are key catalysts for metabolic failure. The Mayo Clinic's Jeff Mayusin, co-director of cardiovascular laboratory medicine, describes them as an excellent predictor of cardiovascular risk and believes they are useful for determining patients' chances of getting certain chronic conditions. Despite this, ceramides are not widely accepted in medicine. Cardiologists will first need to embrace a new test and learn how to interpret the results in conjunction with established risk factors before that can happen. Moreover, before ceramide-lowering medications are administered to patients, researchers will need to demonstrate that tampering with substances essential to the body actually benefits the patient. According to Yusuf Hanan, a lipidologist at Stony Brook University, ceramides were not on anyone's radar screen until a little more than 30 years ago. The few scientists who did consider the chemicals, which are present throughout the body, concluded they were incapable of being metabolized. Hahnemann and his associates conducted one of the initial investigations that contributed to altering this perspective in 1993. The goal of the study was to determine how a certain immune system chemical triggers cancer-fighting malignant cells to commit suicide. They found the molecule interacts with ceramides, indicating the role of lipids in cell communication. A new method known as liquid chromatography mass spectrometry soon after transformed the study of lipids. Since the method, which can sort intricate chemical mixtures, revealed that cells contain a wide variety of ceramides, mammals boast more than 200 types, scientists have been attempting to elucidate the roles of the molecules. The skin, which has a very diversified ceramide population, according to scientist Ashley Cowart of Virginia Commonwealth University, is one area where lipids are crucial. Skin cream manufacturers include a lot of synthetic or naturally produced ceramides to their products since they assist maintain a strong protective barrier there. Cells integrate various ceramide types in the skin and other parts of the body to regulate the fluidity of their outer membranes, which affects cellular activities including mobility, division, and communication. Ceramides are used as starting points in the production of other lipids. Weizmann Institute of Science lipid scientist Tony Futerman summarizes the situation thus: "We cannot exist without ceramides." However, as scientists have shown, ceramides may also work against us. They can penetrate the blood artery lining and introduce LDL cholesterol particles, causing atherosclerosis. Nitric oxide, a chemical messenger that relaxes arterial walls and aids in maintaining the arteries' openness, can be inhibited by them. A problem in sugar metabolism that is present in type 2 diabetes and other disorders is insulin resistance, which certain ceramides seem to encourage. The compounds may also lessen the amount of energy produced by mitochondria, the organelles that produce the chemical energy that powers cells. Moreover, the cell suicide that ceramides can cause may harm good tissue and organs like the heart even if it is cancer preventive. Why do ceramides occasionally degrade? Some people have the trait from birth. The length of a ceramide's acyl tail, a region of the molecule that can have between 12 and more than 26 carbons, determines the characteristics of that ceramide. According to Futerman, the length of the acyl chain is crucial to both the physiology and pathology of cells. Generally speaking, ceramide variants with long tails are more harmful, and for unknown reasons, specific molecules with 16, 18, or 24 carbon tails may be the most toxic. When our bodies manufacture too many ceramides, they might become harmful. The dietary fats we consume are broken down into fatty acids, some of which are transported into the pathway that creates ceramides. Normally, our cells only produce a modest number of ceramides. Yet, the manufacturing of the molecules increases when our diet contains too much fat. According to Scherer, the ceramide drought is somewhat of an overflow channel for extra fatty acids. The connection to food likely explains why ceramides increase in so many metabolic disorders connected to diet. For instance, researchers have discovered the following utilizing liquid chromatography mass spectrometry. Increased concentrations of certain ceramides have been seen in people with obesity, type 2 diabetes, non-alcoholic fatty liver disease, and a number of cardiovascular diseases, such as atherosclerosis, heart failure, and stroke. Rat studies also indicate that ceramides might not only be bystanders. Ceramide levels can be reduced chemically or genetically to protect animals from several of these diseases. A few researchers are still not persuaded. We don't know if they are a cause or an effect, according to Futerman. But physiologist Scott Summers of the University of Utah, who has been investigating ceramides for more than 20 years, is one of the researchers who accepts their harmful impacts. The facts have made it quite plain to us that these are significant molecules.
Thanks for watching, guys. This has been part 1. Part 2 should also be up online, and you can pick it up from there, and it continues on the story of ceramides and how they can help in the testing and telling if you've got any kind of cardiovascular event that may happen. And I will see you at the end of 2. Thanks. Bye.